Now, tomorrow and over the weekend, people are going to be taking part in World Mental Health Day. It's in order to raise awareness and funds for the issue of mental health. And here to talk to us more about it is Atif Kamal from Saber, based here in Manchester. Thanks very much for joining us this morning.
First of all, what do we mean by mental health?
Well, mental health refers to our thoughts and emotions, and it's the way we feel and think, and that has an impact on the way we behave. Mental health is about our ability to cope with life's problems and make the most of life's opportunities. So when a person loses that ability to cope or loses the ability to think or properly, then that has an impact, and that's what causes mental health, and that's what referred to as mental health.
So can you tell us a little bit more about your organisation and what you guys do?
Yeah, well, I'm based at Pakistani Resource Centre, which is a community-based organisation based in the city centre. The SEVA project is a project with three organisations in partnership. We basically work with mental health, raising mental health awareness in the community. Part of my work is to do with working within prisons, working with faith groups, and working with community organisations as well, working at the grassroots level and also working at a strategic level. And at the Pakistani Resource Centre we have a number of services available, for example counselling, domestic violence project, welfare rights, mental health, and also working with Black and Asian offenders.
Now, Saturday is Mental Health Awareness Day, isn't it?
Yeah.
Why do you think there's a need to have a day to publicise this, and what measures are being put in place to promote it?
Well, the reason why it needs to be publicised is because there's a huge stigma around mental health issues. People need to be made aware, especially in today's environment, that everybody is entitled to seeking help, even if that's from mental health teams, GPs, and the measures that are put in place. I mean, what we do at the Saber team is when we have training opportunities or seminars, we promote the mental health that's going to be on Saturday, and we do this. To be quite honest with you, World Mental Health Day is only obviously on the 10th of October, but we do this day in, day out. So what we try to do is raise awareness of this day so that people in the community are aware of it and they can talk more openly about this issue.
So what is, you mentioned the stigma there that affects people. Is that affecting the people surrounding people who've got mental health, or does the person who possibly has a mental health issue, do they feel the stigma and reluctance to come forward?
Well, to be honest with you, it's not just the individuals who feel the stigma, it's the family as well. Obviously, I work mostly with South Asian communities, and within the South Asian community there's a lot of stigma with regards to mental health. People don't want to discuss it within the community, let alone with the GPs, because in some circumstances people think, well, it's a family doctor. If this gets out, then there is obviously confidentiality there. But if this gets out in the community, then obviously people think that, for example, if their sons and daughters want to get married, they might not get like marriage proposals. Obviously, it's going to be arranged marriage, so that has a huge impact.
Because there's a lot of ignorance surrounding mental health, isn't there? And it's a social taboo anyway, and then I suppose that's magnified for Asian communities because there's such pressure on for marriages and the community as a whole. It's very important to be a pillar within the community. How do you think we can break down that ignorance?
Well, what we can do is like World Mental Health Day, participate in events that are going on, and basically what we do is go within schools, colleges, community groups, talk about mental health, and then obviously mention it in the community. People need to be made aware of this so that they feel comfortable to come forward, and it's not a stigma, it's not a taboo subject, and people can seek help because obviously it's for their benefit.
Definitely. And 1 in 4 people suffer from mental health. That's staggering. That's 25% of the population. Is it indiscriminate? Is it something that affects mainly one sex over the other, or one ethnic group, or can it affect anybody at any time? Well,
to be quite honest with you, it's more likely to be in women. I mean, I've got some figures here, okay. And it says here that women are more likely to be treated with mental health than men, but saying that it could be, and it did say in the study that not a lot of men come forward with regards to
There's a lot
this.
of
So it could be
pride,
the
isn't
same,
there?
but it's the women that are getting treated and they're the ones that are getting recorded down.
Exactly. And in depression, it's 1 in 4 women. With regards to men, it's 1 in 10. And with
Right.
older people, it's 1 in 5 who face depression.
Right, and also there's some a recent survey done that 13% of people without a job have actually thought about harming themselves at one time, and particularly as we're in a recession at the moment, a lot of job cuts are taking place. So it really is, you know, something that's at the forefront of people's minds at the moment, because people that may have in the past found themselves in a stable situation now suddenly, you know, thrown into chaos and into turmoil. So it's something that could actually be snowballing.
Yes, I mean, financial pressures can cause huge mental health issues, and especially if someone doesn't want to discuss it with their partner or with the family, then 1 week goes into a few months goes into a few years, and what might start as stress might end up in severe depression.
Obviously, Saber's doing a lot of work to raise awareness and help people.
Yeah.
So is that something that's missing from things such as the NHS? Do we, you know, the organisations like yours, is it because there's a lack of things elsewhere?
Well, we are funded by Manchester NHS, so we work in collaboration with the NHS. But the reason why we work mostly with the South Asian community is, number one, obviously there's language barriers, and also we do a lot of work with the NHS to make service providers more culturally appropriate, culturally sensitive to the needs of the South Asian communities. So we do a lot of work with that.
So how important is it to, you know, someone who's from a South Asian community suffering with a mental health issue to be able to speak to someone who can understand where they're coming from?
Well, it is quite important, because if someone's first language isn't, for example, language, if it isn't English, then obviously they won't want to come forward, they won't feel comfortable because they won't understand what the other person's saying. But saying that, I mean, there's a lot of websites, there's a lot of information out there in different languages now, obviously, which people can read and find out what services to go to, basically.
And are you finding that people, once they make that first step, because that can be terrifying, can't it, just to admit that what people see as a weakness isn't necessarily a weakness, it can be because of things that have been thrust upon you in your situation. But once they have that first step, which is very daunting, do you find then that it can get so much easier?
Yeah, it does get easier. I mean, like I said, it is making that first step, and once you've made that first step, you know that you're not alone, because a lot of people think that
It's an isolating problem, isn't it?
Exactly, it's an isolating problem, and they think that you know, there's no one else. They're the only person in the world who's facing this problem. So once obviously they've accessed services, they know that, you know, there are other people who are suffering similar issues, and it's quite comforting to them.
If someone's watching at home thinking, I know someone or myself want to take that first step, what should they do next?
Well, what they should do is, the first point of call is obviously the GP. Mention to the GP what they're feeling. Saying that, I mean, it's best to talk to a friend, talk to family members, and if they want more information with regards to it, there's a number of websites with regards to mental health. If they just put in Google mental health, if it's in Manchester, they'll know about more information about what's available in going to Manchester Library, and just take it from there, basically.
Fantastic. Well, thank you very much. You've really made us aware that there's no shame in it if you do suffer from a mental illness, and there is a lot of ignorance, unfortunately. So hopefully, you know, interviews like yourself this morning will hopefully break down those barriers. Thank you very much.